There are two types of total shoulder replacements, anatomic and reverse shoulder replacement. And what they're really referring to is the anatomic relationship of the native ball and socket joint. And so what we have here is the scapula or the shoulder blade, which features the socket, and the humeral bone, which features the ball. And so it's a ball and socket joint. And when patients go on to lose their articular cartilage and possibly require a total shoulder replacement, an anatomic shoulder replacement is when we replace the ball with a metal ball and we resurface the socket with a plastic socket. The requirements in order to get an anatomic total shoulder replacement are those that have an intact rotator cuff that allow full functioning of this implant and that there's not too much bone loss on the socket side to allow for a cemented or press fit plastic socket to be placed. The other type of shoulder replacement is called the reverse shoulder replacement, and this one refers to a reverse in the anatomy, the normal anatomy. And on this time, we have replaced the ball with a socket, and we've placed the ball mounted onto the previous socket of the shoulder blade, thereby reversing the anatomy. And what this does is it changes the center point of rotation of the shoulder. It allows the deltoid to move the arm in space. And so it's an incredible option for those that have arthritis related to rotator cuff tears. It's often been used much more significantly in patients that have recurrent instability, fractures, bone loss, and is an excellent option for our aging population. This particular prosthesis, the reverse shoulder replacement, has been around for quite some time, but was finally approved in the United States in 2004 and has quickly in the last 5 to 10 years become the more common implant that's given to our patients on a day-to-day basis.